Welcome to Fight Cancer Global's informational video series. Our aim is to empower individuals with knowledge and resources to combat cancer. Today's video will explore how medical professionals determine the stage of a patient's cervical cancer, offering valuable insights and actionable steps to aid you and your family in the fight against cancer. Staging cervical cancer is a crucial step in defining the most effective treatment plan. The process begins with understanding the patient's symptoms. Symptoms such as unusual vaginal bleeding, pelvic pain, or pain during intercourse can serve as early warning signs that warrant further investigation. A thorough physical examination, particularly a pelvic exam, is a key step. During this examination, doctors can identify any signs of abnormal growth or spread of cancer cells in the cervix or surrounding tissues. This initial assessment often guides the subsequent diagnostic steps. The Pap test, a routine procedure in gynecological checkups, plays an important role in the early detection of cervical cancer. The test can help detect abnormal changes in cervical cells that might indicate a higher risk of developing cancer. The HPV DNA test, another essential diagnostic tool, checks for the presence of high-risk HPV strains. These strains are responsible for the majority of cervical cancer cases, and knowing their status can provide invaluable information about a patient's risk. Colposcopy and cervical biopsy are often the next steps if the Pap test or HPV test results suggest a higher risk. In this procedure, a device called a colposcope offers a magnified view of the cervix, allowing doctors to identify and sample abnormal areas for further analysis. Imaging tests such as CT scans, MRIs, or PET scans also provide vital insights into the staging process. These tests offer a detailed view of the cervix and adjacent structures, aiding doctors in assessing whether the cancer has spread beyond the cervix or to other parts of the body. In some cases, tests like cystoscopy and proctoscopy may be needed to check whether cancer has spread to the bladder or rectum. These procedures involve examining these areas with a special instrument to identify any spread of the cancer. Sometimes, surgical staging might be required. This involves removing and examining samples from the lymph nodes in the abdomen and pelvis to check for cancer spread. This method can provide a more precise understanding of the cancer stage. Once all this information is gathered, it's classified using internationally recognized staging systems like the International Federation of Gynecology and Obstetrics (FIGO) system or the AJCC-TNM staging system. These systems help standardize the understanding of how far the cancer has progressed. Finally, it's important to note that the final staging and treatment plan is often a collaborative decision. A multidisciplinary team of cancer specialists, including oncologists, radiologists, and surgeons, will discuss and agree upon the best treatment course based on the stage of cancer and the patient's overall health. To summarize, staging cervical cancer is a comprehensive process that includes understanding a patient's symptoms, conducting various tests and procedures, and collaborating as a team to define the most effective treatment plan. Thank you for viewing this informational video brought to you by Fight Cancer Global. For additional content and support, you can visit our website at www.fightcancerglobal.org, where you will discover a great many resources as well as a supportive community that knows your cancer journey. Let us join forces and make a meaningful impact in the fight against cancer.